Welcome to Ghost Platoon's Core Concept Series, a series that covers Ghost Platoon's implementation of Army doctrine and standard operating procedures. In this video, we will cover Phase 2 of Ghost Platoon's Casualty Care SOPs, Tactical Field Care. What is Tactical Field Care? Tactical Field Care happens when you, your casualty, and your unit are no longer under fire. This is when medics do most of their work following the TCCC guidelines. In Tactical Field Care, we focus on the MARCH acronym. MARCH stands for Massive Hemorrhage, Airway, Respiration, Circulation, and Hypovolemic Shock. Next, we'll talk about triage. When there are multiple casualties, triage is essential to prioritize who needs help first. Here are the classifications. Number 1, immediate. This person needs immediate medical care to prevent death. Number 2, delayed. This person needs care soon, but not immediately. 3, minor. This person needs minimal care and can often treat themselves. And finally, 4, deceased. Cannot be saved without jeopardizing others. Prioritize triage based on the severity of injuries and the role of the casualty. For instance, medics get high priority. Next, we'll talk about the triage order. Number 1 in the triage order is the worst massive hemorrhage. Number 2 are your unconscious patients, those that are in cardiac arrest or have been in cardiac arrest for the longest time. Number 3 are the most valuable team members, such as medics, squad leaders or team leaders, and critical weapon systems or skills. And then finally would be the conscious with minor bleeds or broken bones. The conscious with closed wounds needing stitches or pain management as well. Next, let's look at the equipment available for these scenarios. This will help you understand how to use these tools effectively in each phase of care. While dealing with a massive hemorrhage, the first piece of equipment you will use is a tourniquet. After tourniquets are placed, then you will move to bandaging the patient. When bandaging, there are 4 types of bandages that will be used. They are basic field dressings, which are used for small wounds, packing bandages for puncture or velocity wounds, elastic bandages for any wound that can reopen, and quick clots. These are often combined with elastic bandages and can help slow the bleeding. Once the bleeding has been stopped, you will need to work on airway management. To do this, you will need to remove occlusions by turning the head, use manual suction pumps if needed, or use King LTs to help keep the airway open. If those are unavailable, you can hyperextend the head. Now that the airway has been managed, you can move on to respiration. Use chest seals for a pneumothorax. Use needle decompression kits for a tension pneumothorax. Finally, you can use bag valve masks to maintain oxygen levels. Once respiration has been achieved, you will move on to circulation. Pulse oximeters can be used for monitoring circulation by providing quick, non-invasive measurements of heart rates and blood oxygen levels, ensuring prompt detection of any issues. Finally, you will assess and treat hypovolemia. You will want to establish a 16-gauge IV in a non-tourniqueted limb or a fast IO in the chest to push fluids. Use blood and plasma for clotting and fluid levels. You can use saline in place of blood or plasma, but saline only raises the fluid levels. Now, we will turn our attention to post-arrest care. The first thing you will do is monitor the patient's vitals and push fluids as needed, bandage or replace bandages, stitch wounds if needed, and finally, fix fractures and call for additional help if surgery is needed. This concludes a demonstration of Ghost Platoon's tactical field care procedures. Remember, proper training leads to proper utilization. If you like what you see, or you are interested in joining our community, stop by our Discord.